I'm Dr. Camille Christian, a consultant cardiologist at the Kingston Public Hospital, and I also operate out of the Heart Foundation of Jamaica. Heart disease is heart disease, and it affects both men and women, but there are some things such as risk factors that tend to be a little bit different in women than they are in men. Women don't do very well with certain risk factors, and we tend to have a much poorer prognosis when it comes to certain things. So I'll give you an example. So like smoking, right? Smoking is a major risk factor for heart disease, and women who smoke are at a particularly higher risk of heart disease than those who don't smoke. And this is especially true for women who are very young. One reason for this is that smoking tends to affect estrogen levels, and estrogen tends to be very protective in heart disease in women. So by smoking, you tend to, remove that protective benefit, and so it exposes your risk of heart disease even more. Diabetic women also have a poorer prognosis than men as it relates to heart disease. And maybe this is because they tend to have a lot more comorbidities. So they tend to have higher levels of obesity, hypertension, high cholesterol levels. And this combination tends to put them at a significantly increased risk of heart disease. When they do develop heart disease, their prognosis also tends to be a little bit poor, and they don't do as well as men do. So symptoms of a heart attack are pretty much the same for women and men. However, women can have atypical symptoms. For instance, they may not have the classic symptoms of, pain in the chest that feels like an elephant sitting on the chest. Sometimes they present with just shortness of breath, sometimes nausea, vomiting, sometimes pain in their left shoulder or in their back. And many times the pain doesn't have to be severe, and these symptoms are attributed to gas. And it's not until they present to hospital that, we will really know what's happening. The good thing about women, though, is that they tend to come to the doctor and they tend to present earlier than men do. Men tend to sit at home and watch it, whereas women are very more eager to go to the doctor. So usually we will discover these symptoms, fairly easily, where treatment can be given. There really isn't any significant difference between treating men and women. Everybody's treated the same as it relates to heart disease. To reduce the risk of heart disease in women, there's several things that can be done. 1, exercise. So you want to do at least 30 minutes, a minimum of 4 days a week, of some sort of aerobic type of activity. So whether it's walking, jogging, swimming, playing a sport, but something that gets your heart rate going. 2, if you smoke, stop smoking. By quitting smoking, you will significantly reduce your risk of developing heart disease. 3, eating healthy. A healthy diet, which consists of low fat, high fiber, drinking lots of water, will also help to reduce your chances of getting elevated cholesterol levels. If you're hypertensive, lowering the sodium in your diet will also help to reduce blood pressure. These are particularly important if you have a family history of hypertension. Then your chances of becoming hypertensive are greater. 4, if you are diabetic, maintaining an optimal control of your diabetes is going to be extremely important in reducing your risk of heart disease. Diabetics are very high risk for developing heart disease. We treat a diabetic in a similar way as we treat somebody who has already had a heart attack. That is how high risk diabetes is. So maintaining perfect glucose control is the only way we're going to help with minimizing the onset of heart disease. 5, maintaining an ideal body weight. That means, again, if you are over your ideal body weight, you need to lose weight. And this is only going to be done through proper eating and exercise. 6, stress reduction. Women can have very stressful lives as they are juggling family life, work life, and it can be very stressful and very demanding on them. So, trying to cope with stressful situations is going to be very important in maintaining a healthy heart. So, stress reduction through, again, exercise, which is very helpful in reducing stress, or even taking up something like yoga or learning meditation. By reducing stress, you can help to reduce your blood pressure as well. So it's also important for that aspect, as it can also be related to other conditions of the heart, such as broken heart syndrome, where this is a condition where profound stress affects the muscles of the heart and causes it to not function properly. So the heart becomes weak. This is usually due to a profound emotional distress, such as the death of a spouse, the death of a child, the death of any loved one. This causes a huge rush of adrenaline, and it's believed that this actually weakens the muscles of the heart, causing it to not pump very well. The good news with it is that most people recover over time. Usually it takes about a year or two, but the time varies. The classic age group is middle-aged to older women, but it can affect any age group. Hormones tend to have a protective effect on women. So in the premenopausal age group, your hormones protect you from heart disease. Once you have undergone menopause, then you remove that protective benefit and your risk of heart disease increases. So women tend to be at a higher risk of getting a heart attack in the postmenopausal age group. In premenopausal women, however, they are at a higher risk of getting heart disease if they smoke, and especially if it's in combination with taking certain drugs such as oral contraception pills that can increase the combination can increase your risk of getting a heart attack. So women who have risk factors for heart disease, meaning they smoke, have high cholesterol, hypertension, or diabetes, and they have chest pains, it should always be checked out by a doctor, because it could be a heart attack that you're actually having. So you should seek medical advice, get an ECG done to make sure that it is not heart disease that you're suffering from.